Hi, everybody. My name is Christopher Hall. I'm the president of AHC. We specialize in integrative medical therapies, especially infusions. And so today I actually wanted to talk to you all about detoxification and how important it is to detoxify your body. The world that we live in is really polluted. In fact, there are more toxins present on the planet today than there ever have been in the entire history of humankind. And a really good website that I love to go and visit on occasion. It's a little scary sometimes, but it's called worldometers.info. So worldometers.info. On this website, you'll actually get real-time feed on how many people are alive on the planet, how many deaths there are every year. One of the most fascinating that I find on the website is how many toxic chemicals have been released into the atmosphere or into the earth this year. And last time I checked, it was about 7,600,000 tons of toxic chemicals that were released onto the planet this year. So no matter who you are or how healthy you may be, we all breathe the same air. We eat food that is grown with water that's contaminated. Even though you're eating organic, you're eating non-GMO foods, there are still toxins present. A lot of studies actually show that organic foods have about 60% less toxic exposure to them, different pesticides or insecticides or fertilizers, than regular conventional foods do, but there's still chemicals present. And so detoxification, cleaning out the body, is incredibly important. And one of the things that I like to do for myself, and that Wendy, our medical director, actually does for the patients coming in to the clinic, is we have them do every 6 months a kidney cleanse and a liver cleanse. And there are a lot of different ways to do this. Kidney cleanses can be done through different herbal supplements or teas. One of the best things that you can do on a daily basis to help your kidneys is to drink plenty of water. And I'm not talking about just regular water, well water, tap water. I'm talking about good quality filtered water. Hexavalent chromium is actually found in about 2/3 of the water supply on this planet. Hexavalent chromium is known to cause cancer. And so just because you drink it from a well or because you use a reverse osmosis filter does not mean that the water you're drinking is completely clean. Reverse osmosis doesn't remove everything. Deionization actually removes less than reverse osmosis. But there are certain companies that actually do several different types of water purification. One of them that I know of is called Purified Water to Go. They do 12 different types of purification. They have some of the cleanest water that I've ever seen. The testing that has been done by third parties on their water quality is exceptional. And so I like to tell people, when they ask about how much water they should be drinking, it's different for everybody. Some people think half of your body weight in ounces. So if you weigh 100 pounds, you should be drinking about 50 ounces of water a day. I personally, we live in Albuquerque, New Mexico. We're in the desert. It's dry. It's hot. We really need to drink a lot more here. But if you're living on the East Coast and it's more humid, you may sweat more. So you actually may need to drink more there too. Personally, I drink at least a gallon of water a day, and I replenish with minerals. Whatever, you're going to be drinking a lot of water, you're going to be losing minerals, but that helps to keep your kidneys clean. First off, lots of water and good quality clean water. Second is diet. You got to eat a lot of foods, especially your vegetables, that will help to absorb a lot of the toxins that are in your body and will help your organs to function more efficiently. And so asparagus has got a lot of alpha-lipoic acid in it. It's what makes your pee stink when you eat asparagus. And so, I try to have asparagus a couple of times a week, but then you can also make a parsley tea. Okay, so the way we do that is typically about 4 bunches of parsley. When you go to the grocery store, you buy a bunch, which is wrapped in the little twist tie. So 4 of those, take them home, put them into a half a gallon of water, boil that for about 5 minutes, let it sit for about a half an hour and steep, and then strain everything out of there. Make yourself a nice little tea. It doesn't taste too bad, but it actually does a lot to work as a diuretic and help increase the output from the kidneys. So those are just two little helpful tips. As far as the liver is concerned, you want to make sure that your bowels are moving on a regular basis before you try to detox your liver, because your liver is going to dump all those toxins right into the colon. So if things are not moving once to twice a day, you're not having regular bowel movements once to twice a day, you want to make sure that you get your intestinal tract working well first before you try to do any liver detox. But always start with the kidneys first, because kidneys are going to be your #1 priority, and it's easier on your body to do a kidney cleanse than it is to do a liver cleanse. So kidney cleanse is done, intestines are working well, then you can go into a liver cleanse. There's several different things that you can use for liver cleansing. A lot of people think of milk thistle, dandelion root, burdock root, yellow dock, aloe vera juice. They're all fantastic, and there's several different cleanses that you can do. So that being said, you want to look at different foods that will help the liver detox as well. And so, steamed vegetables, I try to have one meal a day with a large portion of steamed vegetables. No butter, no oil. Okay, no olive oil, no butter on top of them. And yeah, that stuff makes the veggies taste better and all that good stuff. But the oils saturate the fiber in the vegetables and do not allow the veggies to absorb the toxins from my body. And that's one thing I really want to have, is what I call a medicinal meal. Okay, so get this big portion of steamed vegetables: broccoli, cauliflower, yams, sweet potatoes, asparagus. We definitely love the green beans, okra, all that good stuff. Beets, especially beets. Okay, beets are a really good way to go for liver. There's a lot of oxalic acid in the beet greens and things like that, so you got to be careful not to have them too frequently if you're prone to gallbladder stones or kidney stones. But the beet juice and beets as a whole, when they're steamed, can actually be very helpful to detoxify the liver and help open up the portal vein, which is the main blood supply to the liver. And so you want to get plenty of veggies so that you can, your body can do its normal job more efficiently, and that way you don't have to worry about detoxing as often. But we're all breathing in toxins all day long, so let's help our body out. There's a difference between lipid-soluble toxins and water-soluble toxins. Okay, so lipid-soluble are going to be the fat-soluble toxins that are very difficult to get out of the body and bind to the fat cells in the tissues and also to the nervous system. The phospholipid bilayer of the cells, the plasma membrane, can hold a lot of these lipid-soluble toxins, and also the nervous system. And so your liver has to be the organ that is responsible for processing the lipid-soluble toxins and getting them out of your body through your bowels. So you need plenty of fiber to do that. You also have the water-soluble toxins, which are much easier to remove from the body. They go through your skin and your kidneys. So that's where the plenty of water comes in, all the asparagus and parsley and things to help push and move those toxins out of the body. When it comes to those cleanses, I would like for everybody to be doing those cleanses on a regular basis, but that doesn't take the place of doing the IV therapies. And I'm going to fall back on the IVs again, because one of the most impressive IVs that we've seen for individuals with liver problems and kidney problems is going to be alpha lipoic acid and also glutathione. So alpha lipoic acid really helps to take the stress off of the body in a lot of different ways, because it's an antioxidant. It can help to protect the tissues from the toxins that are present in the system. And so think of alpha lipoic acid as being a protective shield around the cells. Think of glutathione as being a protective shield for the neurons in the brain. It really helps to wrap around the neurons, protecting them from harmful damage. And alpha lipoic acid gets to the blood-brain barrier really nicely, so that's fantastic. It also helps the brain and nervous system a lot. So you can do those by mouth. Alpha lipoic acid you can take by mouth anywhere between 300 milligrams up to 600 milligrams a day. And again, just remember on other videos I've mentioned, when you take things by mouth, you get 10% into your blood, which is why I fall back on the IV so frequently. Wendy will usually prescribe a regimen of alpha lipoic acid IVs for patients, maybe 1 to 2 days a week. If it's a severe case of post-chemotherapeutic neuropathy, patient or perhaps the patient has really bad diabetes, real bad neuropathy from the diabetes. Alpha-lipoic acid, she's prescribed in the past daily, 4 days a week, 5 days a week for 3 weeks or so. There have been a lot of studies that have been done alpha-lipoic that actually show great efficacy in dosages of 600 milligrams to 800 milligrams daily for 12 days straight in a row. And obviously the clinic isn't open every day of the week, so Wendy typically will do a regime or treatment plan for the patient, one treatment per day for about 3 weeks. And so when you get a large dose of alpha-lipoic acid into the body, it circulates through your bloodstream about 18 times in the first minute. Gets to all the tissues in a highly concentrated form that you just can't do by mouth. And so on days when patients come in for the IV, Wendy will tell them not to take their supplements by mouth because they don't need it, but to do it every other day. And same thing for the glutathione. Glutathione's a little bit different than alpha-lipoic. It really gets broken down in the hydrochloric acid of the stomach quite easily, so you lose a lot of it. You actually lose a lot more than you would a normal supplement, unless it's in a liposomal form. Okay, now liposomal is a specific delivery method that is incredibly helpful because it protects the substance that's wrapped up in the liposome from being digested by the stomach acid. So you actually get more of it in your blood. And in our clinic, we actually do sell liposomal vitamin C. We used to make a liposomal glutathione. We're going to start making that again, but as of right now, we just make the liposomal vitamin C. And either way, take your supplements by mouth. The injections into the bloodstream are so strong, so potent, that they actually help to really saturate the tissue and do a whole lot of good. And so we use the IVs to really boost the person up, and then their supplements over the next week to 2 weeks before they come in for another IV help to slow down the loss of the supplement, the substance when it's infused. And so they'll get an IV of alpha-lipoic acid. That then what will happen is, without taking alpha-lipoic acid by mouth, that IV level of alpha-lipoic will drop off very quickly in the bloodstream. Whereas if they maintain it by taking alpha-lipoic acid by mouth, the amount that's put into the blood slowly tapers, and they get much more benefit over the long run. Same with the glutathione. It's all about getting the infusion done once a week or once every 2 weeks, and then maintaining everything by mouth so that you don't lose as much, but it increases the efficacy of the IV. Make your money go further. And so I guess that's pretty much what I wanted to discuss with all of you today. Our glutathione IVs for the month of October, they're 15% off for the entire month. And our Myers cocktail packages are, you can do a 3-pack and they're $190. And you can actually add glutathione to the Myers cocktail. And glutathione, just so you know, when you mix it with vitamin C, glutathione recycles vitamin C over and over and over again. So you actually get more out of the injection than you would normally. So it makes your Myers cocktail stronger, and it makes your money go further again. And then the last special we're having for the month of October is liposomal vitamin C. It's 40% off this month. And that's a big seller. Everybody who knows about the liposomal vitamin C, they really, really love when we do a special. So I hope you all enjoy that. Otherwise, we're still working on our live feed issues, the streaming. It seems that Facebook just doesn't want to work with me on the live feed, so I'll just keep making these videos for you and trying to get more information out to the public about what we do here at the clinic, and also the things that I use for myself and that Wendy will suggest for certain patients. Now remember, everybody's body is going to be different, and not all of you should jump out there and do a cleanse right away. You really should talk to a physician or a healthcare practitioner that you trust, hopefully somebody that's well-versed in integrative options for your health, and that way they'll know what you're talking about. Otherwise, of course, you're always welcome to come into the clinic and to see Wendy, get your live blood done, and get an infusion and become healthier with all of us. So I hope you have a great afternoon. Bye-bye.